You're on mute.
Welcome to Catholic Health Australia's webinar, Courage, Hope and Action, Advancing Aboriginal and Torres Strait Islander Health and Wellness Outcomes as Mission Imperatives. I'm sorry for the false start there where I was on mute. My name is Bridget Meaney. I'm the Director of Mission at Catholic Health Australia. I am joining you today from the Greater Kulin Nation, the lands of the Wurundjeri Wondoon people, but I was actually born on the very south lands of the Thorawal people in New South Wales, who still live in community on that land today, caring for country. This land where I was born is known for its beautiful forests, pristine beaches, white sand and wonderful supply of fresh seafood and vegetation. This is actually something noted in the history books by the first European arrivals in the area that I was born, particularly how healthy and strong the Aboriginal people were comparatively to themselves coming off the ships. Their connection to the land had meant they had cared for this land so well, and in return, the land had cared for them. Reflecting on this balance is why reconciliation is so important to me, restoring the balance with land and health that was disrupted. I am of a generation that did not receive much cultural education on the history of where I lived growing up, and I'm always eager to learn more so that my children will grow with more knowledge on this rich history and more understanding and a greater encouragement for reconciliation. It is on this note that I acknowledge the traditional owners of the land on which I was born and from where I am joining you today, and all the lands from which we're all joining. And I pay my respects to elders past and present who have been resilient in their continued care for thousands of years. I particularly welcome any Aboriginal and Torres Strait Islander people joining us today, including our panellists. In 1986, Pope John Paul II, in an address to the Aboriginal and Torres Strait Islander peoples in Australia, called for a new courage and a new hope. He said, "What has been done cannot be undone, or what can now be done to remedy the deeds of yesterday must not be put off till tomorrow." As part of this call to action, Catholic Health Australia is focusing this webinar today on the very crucial topic of Aboriginal and Torres Strait Islander experiences and healthcare and culture. Importantly, it will seek to focus a lot on truth telling and delving into those spaces that are a bit ignored or overlooked or sometimes assumed in contemporary conversations that we might have. The questions I will ask today have all been submitted from across the Catholic health sector leadership, things that they are interested to learn more about, or maybe things they are a bit cautious to ask publicly. Importantly, I'm not an expert on this topic, and I'm still on my own educational journey as a moderator. So I thank our panelists for agreeing to participate and lend us their hearts and their expertise. It is in this context that I ask, as we join together in this space, that we engage with infinite respect and open hearts in embracing those provocations and vulnerabilities as we work towards reconciliation. On that note, I would love to welcome, and it's my absolute privilege to welcome, Darlene Dries, Jo Jones and Marika Giacomos as our panellists today. These are all wonderful Aboriginal and Torres Strait Islander leaders in our healthcare and aged care sector. I won't read aloud their biographies because I want to invite them all to tell their own unique story in their own way. So on that note, it's my pleasure to kick off today, and we might start with you, Darlene. Are you able to tell us a little bit about you, your Aboriginal and Torres Strait Islander heritage, and maybe share one aspect of your culture that you're particularly proud of?
Sure. Thank you very much, and hello, everybody. I'm Darlene Dries. I've been around the Catholic health space for a few years now, but it's lovely to be with you all again today. I identify as an Torres Strait Islander woman. My mother's matrilineal connections extend to Hammond Island or Kariri in the Torres Strait, which many refer to as a Catholic community. And as of about 5 weeks ago, and I've shared this with some people, I also identify as having Aboriginal heritage, which was something that had been spoken about all my life. But with the passing of some and the voices being stronger of others in the family, that has now come to a place of confirmation. So I'm sitting with that. I don't share that as it's not anything to do with ancestry.com. It's actually to speak something to the complexity of our identities and heritage, the impact of colonialism, and why that wasn't comfortable to share amongst family members earlier in the piece. So I just turned 54, and I can now say that I am Aboriginal and Torres Strait Islander, and also have Chinese heritage. Something I'm particularly proud of is I always think of family first and foremost, the capacity and the strengths of family in the face of incredible intergenerational challenges. And one particular thing too is also our capacity to speak about mental health and to do mental health check-ins in a very comfortable way amongst each other.
Wonderful. Thank you, Darlene. We might move to you, Marika. If you can share with us a bit about you and your culture and your history and something you're proud of.
Oh, thanks, Bridget, and hi to everyone. So this is weird not being able to see any of you, but anyway. So yeah, I'm Marika Jacamos. I've been working here at Mercy Health for just over 11 years now. I'm a proud Yorta Yorta woman. I'm also a proud Greek woman and African American. So my Aboriginal line follows through my grandmother. She was born and lived on Cumragunja, which is on the border of Victoria and New South Wales. So Cumragunja is on the New South Wales side. It was a mission that a lot of Yorta Yorta people lived on. She was there around the time that the walk-off happened in 1939 it was, but her family chose to stay and make sure that the land, the Yorta Yorta land wouldn't be sold off. So that's where, I'm really proud of my grandmother. She's passed on, and as my grandfather, but I'm very proud to be a member of the Jacamos family that have been for years really strong advocates in Aboriginal rights, that have fought for our people to have services such as even health services down here in Victoria, and have been amazing role models and left an amazing legacy for our family. So that makes me really proud to be who I am, and very proud of, the people that I get to call family.
Thank you, Marika. And Joe, a little bit about you.
Hi everyone, so I'm Jo Jones and I'm the Reconciliation and Action Plan Manager for MARTA statewide. I'm a proud Wiradjuri woman from Parkes in New South Wales, born and bred down there, and moved up here over 40 years ago, and have had an amazing career life in child safety, health and other domains. I suppose for me, it's the connection to land and the connection to community that I get out of my culture. And especially where I am today, I suppose for me, it's that living that part of get that knowledge, get that education. I've got a bachelor in social work, community services works, child safety, things like that, and never give up. Like, I think that was what I was raised with. You can do anything you like, just never, ever give up. And my main inspiration for what I do now is to give that empowerment to my mob for the best healthcare that we can provide, education, housing, and so forth, for closing the gap and reconciliation.
Wonderful. Thank you, Joe. You've all spoken about, things that you're immensely proud of in your culture, whether that be your family's legacy, the ability to talk about mental health. Why is it that Aboriginal and Torres Strait Islander people still, find it very hard to identify publicly or in the workplace? We still know that that's a persistent problem or challenge that we need to overcome. Why is that, and how can we encourage that self-identification more readily as in the Catholic health sector? I might go to you, Darlene.
Thank you. The thing that immediately comes to my mind is the revealing of that information. People need to be very clear about what the purpose of that is. And even asking that question can be quite harrowing for staff who ask it and for people who are expected to respond. We're not so far away from a time when our facilities, our healthcare facilities and hospitals, were regarded not in a particularly positive way as institutions, and the care that may have been provided to Aboriginal and Torres Strait Islander people may not have been on par with others in the community. So that's in the lived memory, and many would argue that that may still be an experience. I don't think it's anything necessarily to do with pride in culture or heritage, but just that openness as to why we ask this question. And it's always because so we can enable the best outcomes and we can connect care beautifully. I guess even in talking to the ladies in preparing for this panel, there's a continual sharing and revealing of who we are as people that's probably above and beyond what other sectors of the community might experience. So it is important, no doubt it is important, but it's the way and it's the purpose for which those questions are asked.
Darlene touched on something there, Marika and Joe, around, that very direct racism that has occurred, that kind of creates a barrier sometimes for people self-identifying. A lot of people won't acknowledge that they're racist or what they've said is racist. There is inadvertent or unintended racism that has to be counted as well, I think. How do you think we can improve cultural awareness of the public or people working within Catholic Health so that, Aboriginal and Torres Strait Islander, patients, residents, clients, or even staff are not subjected to even inadvertent or incidental or unintended racism? What's been your experience there, and how do we build resilience and a sense of security for those in our care?
Yeah, no, go Joe.
Marika, do you want to go or me?
Sure. I think probably understanding cultural safety and the whole concept of cultural safety and what that means. So, I mean, the important parts of cultural safety is people not feeling there's any assault or challenge or denial of their identity. So feeling as if they're safe to be them in any space. So that includes in the healthcare setting. So when you talk about racism and I guess someone feeling as though, someone's been either advertently or inadvertently a racist towards them, I think the experience of that individual is the most important thing. So if someone says to you or anyone else, I feel culturally unsafe, it's about taking that experience seriously, even if, it may involve someone that, as you said, Bridget, would you say, I didn't mean to be racist, or that was definitely not my intention. It's definitely taking that person's experience and understanding what made them feel culturally unsafe. So again, it's about making sure they're safe to be who they are anywhere. So part of that is obviously education. I mean, when we talk about asking the question, we do a lot of education here at Mercy around asking the question, whether with frontline staff or, doctors and nurses, midwives, everybody throughout the whole service needs to understand what asking the question is, why they need to ask it, and how to do it sensitively. So, and also the understanding that we have, particularly down here in Victoria, we have a lot of people who aren't really strong in their identity. So when they're asked if they're Aboriginal or Torres Strait Islander, they may not feel safe to answer that question because they might be questioned about that, or may feel they'll be questioned about that. We have people down here who can't tell you who their mob are, as in who their tribe are or their clan. So we need to respect that. And it's not just stolen generation. We have a whole generation of people who are just finding out that they're Aboriginal, or it may have been hidden within their family and they've just come to know that. And so they're on their journey. So I think that's particularly important to be aware of and understand as well.
Absolutely. And that's reflected in Darlene's story, still discovering, your identity, even when you've been involved and you've been a leader throughout your career. Joe, did you have anything to add to that?
No, I think she covered off pretty well on that one. I suppose just providing the support environment and clear processes in the workforce to explore the cultural needs of our Aboriginal and Torres Strait Islander staff that are in there, and doing the cultural awareness modules and having things put in place and protocols just to protect us in the workforce.
Absolutely. Thank you. My next question, goes to some of these difficult conversations that we need to have, that truth telling. And one of the things that I've, in my brief experience in this is that's become difficult to talk about is the fact that, Catholic hospitals and aged care facilities across the country were built and continue to operate on land taken from Aboriginal and Torres Strait Islander peoples. With that truth said, what does reconciliation look like in this context? People automatically jump to, do we have to give the land back? What happens to all the good work we are doing? What's the path forward once you acknowledge that historical fact? And what's been your experience in those conversations around wrestling with those hard truths?
Yeah, so I think acknowledgement and apology, when we got the national apology was awesome. Land rights and our the culture, just ensuring that Indigenous culture and practices are respected and operate in a way around the lands on which the hospitals and everything are facilitated on. I think that's one of my big things, is just acknowledging the fact of history, and what happened. And yes, I know there's a lot of things changing, which I've seen from being a child till now, where they're renaming islands and renaming different things. Like you get off the plane now and it tells you that where you are in Aboriginal language. It's beautiful to see. It's bringing all of that together, and reconciliation is just that. It's closing the gap. It's bringing us all in line and equal opportunities, equal for everything. So I think that's the main thing.
Wonderful. Thank you, Jo. Darlene, what's been your experience in wrestling with some of these difficult conversations around, our own Catholic hospitals and aged care facilities operating now on land taken?
Thank you. Thank you. And I'm speaking amongst friends here. I'm going to claim that, even though I can't see many of the participants. And you said at the beginning, Bridget, this is about infinite respect. And so I extend that in my response. It's a provocative question. I love that little bit thrown in there about, do we give land back? With the learned people in the circles that I move in from time to time, including Indigenous and non-Indigenous, that's not an unreasonable expectation by some sectors of our community. Pull in a group of, legal eagles, I think there would be able to be a basis for that approach. But is that my basis? No, it is not. But for some people it is. And that's a reality. And when we get deeper into the truth telling, you can see why. Actually, that may not be an unreasonable feeling to hold. So I wanted to honour that. Operating facilities on lands never ceded, that is a reality today. I think I'm speaking now in my experiences of mob Aboriginal and Torres Strait Islander people. It's not so much about that land being given back as for us to be full participants in the economic realities and, the commercial enterprises, and to share in the wealth and contributing to the works of the facilities. So when we look at reconciliation and we talk about how that is more than the people in the beds or the residents in our care, it is about our staff. It is about ensuring financial security, intergenerational change, as well as those incredibly important clinical care outcomes. It's rethinking the machines, the organisations that we stand at the helm of. Our history is complex. It is beautiful. But it is complex. What makes things right now, and how do we view that through our Catholic social justice lens? There are ways to restore justice in this setting, I think, that benefit all.
Wonderful, Darlene. That was just so beautifully phrased. Marika, did you have anything to add to that? What's been your experience of wrestling with these kind of
I think it's just probably acknowledging, I guess, what the legacy of colonisation has meant for Aboriginal and Torres Strait Islander people. That even the apology, you know, and I've been told in the past, oh, you know, sort of what more is there for white Australians to do, given, you know, Rod made the apology, what more do you want from us? And I sort of said, well, okay, that's just, I mean, I thought the apology was amazing. I remember sitting in my car with tears streaming down my face listening to it, but we still have such a long way to go. And I think people often feel really personally attacked, you know, when we invite them to be part of reconciliation or part of the solution or be an ally or be, you know, don't be sort of a passive bystander. Please, you know, join us in reconciliation. People sort of sometimes say, well, you know, I wasn't involved in, you know, the past wrongs. I wasn't, maybe it was my ancestors or whatever the case. But I sort of say, well, this should be a shared responsibility for everyone. It's not about pointing fingers or blame. It's about, you know, helping us be part of the solution. So yeah.
What I'm hearing is, you know, it is, and that's certainly been my experience working with you three, is that it's deeply invitational. And it so aligns with our Catholic mission to, you know, rethink the healthcare machine, that it isn't this transactional nature of, you know, connection. There is something more to be said about humans working together for a common good. So I've really certainly been exposed to a lot of the links you can draw there, and some of the things that you've spoken about. You touched on this, Marika, around, you know, there's so much more to do. There's just, you know, the apology was really a kind of hopeful commencement of all the things that need to still be done. And so I might give a follow-up question there, Marika, around, we know all the health disparities. We know that's also, there's so much evidence, it's all recorded. Are there things that aren't talked about as much in that space around health disparities that need, you know, more of a profile, or things that people just are uncomfortable talking about from your experience?
We touched a little earlier on racism. I think that many try and sort of avoid that word and try and play it off like, you know, that's probably, you know, that one of the utmost worst things you could accuse someone of. But I think we need to talk more about that. We need to talk about bias as well, and that it's very real. And that people, Black presenting people walking into health services are often treated a little differently sometimes than others. It's really real. It's something that my team and myself have seen in you know, when we've worked with our mob at both sites. We've seen this. It's very real to us, and I feel like it's something that, you know, that is not talked about enough, and people don't want to talk about it. I've brought it up with people before, and the response has not always been good. It's like, well, you're sort of talking about something that either they don't understand or have never experienced. Therefore, if you don't have that lived experience of discrimination, you don't understand it.
Yeah, the racism and bias, I think, requires a lot of self-reflection that people sometimes fight against, you know, as an instinct, doesn't it? Jo, is that something, racism and bias, is that something that's you've experienced as hard to wrestle with in kind of public conversations, or within workplaces, your community, or are there other aspects that you think need to be talked about more, as difficult as they might be?
No, I think that's you know, it's exactly what Marika said. We've all experienced it, and it is a hard conversation to be had. I think that's where we need to bring in that, you know, provide that cultural awareness and cultural safety training in the workplace and in community. You know, for us, we can sit around and talk about racism, and we can talk about the effects that it has on our mob to each other. But when you raise it to others or within the workplace and things like that, it's that's when it becomes that hard conversation where people don't want to address it. So yes, work in progress.
Yeah, lots of work to be done. Darlene, did you have anything to add to that about difficult topics to wrestle with?
I would agree with the other panelists there about racism and bias. Also wishing to make the point, though, that that is not just belonging in the realm of Aboriginal and Torres Strait Islander peoples. You know, racism and bias can go across other groups that we care for. We have a particular focus on Aboriginal and Torres Strait Islander peoples for today, but the learnings that could be generated, the unpacking of actual episodes of care, the feedback from patients and staff and residents that we can put on a table with infinite respect, actual examples, words used, context. When we understand that more deeply for us, the learnings from that can go across the board. So, you know, when we become really good at this, it's sharing those learnings to benefit all. Our focus here is for Aboriginal and Torres Strait Islander people, and that will be my focus. But the lessons go beyond this space, and I think sometimes we don't always see that clearly. We don't need to always be the recipients of extra care or, you know, extra education just about us and our situations. They're general learnings as well that can arise and elevate across the board. And in that way, we demonstrate leadership. We take, you know, these episodes of concern or pain, we unpack them, we learn from them, and that, you know, has implications for our services and our care.
Yeah, there's a real opportunity to make a broader contribution if we get this right, isn't there?
Yes.
I you know, I wonder if people are, you know, and in my discussions with people, there's this fear of saying the wrong thing or doing something wrong or using the wrong words, pronouncing something wrong. You know, a good example is when you call someone auntie and uncle when you don't, how that works. How do we bridge that gap to kind of reduce that fear a little bit amongst our own communities or workplaces, Darlene?
Comes back again to those two words from the beginning for me. It's about infinite respect. I think that fear is held, it's held a lot by people who wish to engage with Aboriginal and Torres Strait Islander people for all the right reasons. I just accept that there may be a fear within them, and that can present in different ways. If you're in that great relationship and people can actually name that, I always like to say, well, we're stronger together, so let's learn together. The example about uncle and auntie, you know, that comes up a little bit. If we had 27 panelists here instead of 3, I think you might get 27 different points of view from Aboriginal and Torres Strait Islander people from wherever they are around this great land. That's okay. If we can approach these conversations and these interactions again with infinite respect, to me, that's my underlying premise. So I may talk to someone one day and they say, yes, please do. The next day it might be another person. Oh, no, please don't. I just go with that. That's respect. Whether I'm talking to First Nations people or members of the public. So there's some, you know, I know that this thing kind of happens, uncle and auntie, but I'm still going to afford everybody respect and just see what people's preferences are when they come in.
Wonderful. That makes total sense to me. I think it's meeting each other halfway and sitting with that discomfort a little bit and learning together. Jo, have you encountered that kind of fear amongst, you know, you're working with staff at MARTA who are on an educational journey as well. Have you encountered that fear of sometimes doing or saying the wrong thing, and how do you tackle that?
I suppose in my position, I like to say to them, you know, there's no stupid questions, there's no wrong answers. Come and have a yarn. You know, my door's always open. You know, like they can come by themselves, because some people want to ask questions, and you know, they might not feel comfortable that they're going to say, like you said, they're going to say the wrong thing or the right thing in front of others, and whether they get embarrassed or feel like they're racist. And it's like, come and have those conversations, because that's what I'm there for. I love to just sit and yarn with people. And as you said, with the auntie and uncle, I suppose for me, it's more about how they introduce themselves and how they would like to be called, because it's location specific as well. Like, you know, so I'm Auntie Joe on the Gold Coast and out in community for many people, and especially in the care settings when I go out there and do cultural awareness talks and things like that. But at work as a professional, I like just being called Joe Jones. You know, but yeah, always there to educate. And with the knowledge and skill that all of us have here as Aboriginal women, Torres Strait Islander women, I think that is the main benefit to all of the places where we are located and where we work, that they've got that there. You know, they can come to me and Darlene and Marika in that workforce space, and we can give that guidance and knowledge, and, you know, in a nice way, you know. So I'm open to anything that anyone at MARTA would love to come and have a chat with me about, and yarn and give them that knowledge and experience and that comfort in being able to engage with our mob.
And Marika, you know, you've got a wealth of experience in this space, as has your family. You know, they've kind of worked really hard, and you've got this enormous legacy for kind of having those conversations. What's something that, you know, you've learned around breaking down that fear or that insecurity?
Yeah, I mean, just talking and getting to know people. I mean, I'm the same as Joe. I've said to people, there's no stupid question. I'd rather people ask me whatever question they had, or, you know, something they weren't sure about, rather than go out there perpetuating something inaccurate about our people, or not understanding something about our people. I'd rather they'd ask. I think the format of this forum, for instance, was good because everybody got an opportunity to get their question, and obviously it's anonymous too, so they don't have to actually ask the questions. They're there already. So, you know, even a couple of them, admittedly for me, were like, oh, okay. But, you know, I'm still really glad that they're being asked. I think it's important to really get to know our people and just communicate really clearly and effectively with them. I think half the reason why there's misunderstandings or people don't feel they're being treated appropriately is just lack of communication and person-centered care.
Mm-hmm.
They're just not getting the respect and understanding that they deserve, and the right to self-determine as well. So, yeah, I mean, and on the topic of auntie and uncle as well, I mean, at the moment, I mean, I'm not quite 50 yet, getting there very quick, very fast, but I mean, for me at the moment, only my nieces and nephews call me auntie. I'm not quite at that stage, but someone my age and community might prefer that younger ones address them as auntie. So that's a very individual thing. Yeah, so that's up to the individual person.
Yeah, that I think that person-to-person communication is so important, because as Darlene touched on before, you know, there's a diversity of views. If you had 20 people in a room, they'll all give different answers, because it's not a homogenous experience, or, you know, there's nothing necessarily that's exact about any one individual, including Aboriginal and Torres Strait Islander people. So I
Richard,
think that
sorry.
person said, yeah. No, go, Darlene.
I was just going to say that this applies to us as well. So I'm not going to speak for Joe or Marika, but if I'm meeting elders in community or other community members who are Aboriginal and Torres Strait Islander, I will ask that. May I call you aunt or uncle? It may come back yes or no. They might say, why do you want to do that? I'll respond. And if not, they'll say, oh, no, I'd prefer you call me Jack or Mr. Such and such. I will go with that. So it's the same. I think we would extend that respect as well.
Absolutely. I learned so much from our discussions, Marika, Jo, Darlene. And, you know, one of the things that we've been thinking about is how we, you know, if there were more people with your expertise or more people who were of Aboriginal and Torres Strait Islander identity and heritage and culture working within services, not necessarily just in, you know, leadership roles for Aboriginal and Torres Strait Islander reconciliation, but also just within clinical roles, what a difference that would make to the types of care and the culturally safe care we could deliver. How do we just start to grow that a little bit better, to fulfill our mission around, you know, culturally safe and appropriate and person-centered care? Darlene, I might go to you. No, Darlene's having issues. We might go to
I'm
you.
on. I'm here. I'm here now.
Darlene's back. There we go.
That was my sophisticated symbol for not me. So we bring a wealth of expertise and knowledge and life skills and lived experience to the table, to this table. And I want to sort of throw that question back. If we think about 186 years of the Catholic missionary missions impact in this land, and we look at our leaders today, bearing in mind people serving in missions came here for a particular reason, and we're, you know, that could be captured in words such as service to the poor and vulnerable, that of a time. 180 odd years later, what's changed in that? Is it still people and populations at the receiving end of those ministries and services? Or where has that escalation of moving to leadership come to? And so we're here together, we're as friends in a bigger Catholic family, but if you look inwards, if you look at your leadership structures and beyond, you know, to the highest levels, where is that representation? Not because we want to count that we have an Aboriginal or Torres Strait Islander person in the ranks. That's not right. But the fact that we also bring expertise and knowledge about workplace health and safety, you know, we've got some people who are guns in the AI technology sphere, management experience, clinical, of course. So if it isn't happening now, and that's okay, because we should know our stories and what the reality is, but what are those barriers that we might hold within our organisations? Or what are the things we think we hold? The things that, the roadblocks that we might just be too hard. You know, this is the moment where we can actually sit down and think, yeah, actually, if an opportunity were to open up tomorrow, or we could advance some staff in our organisation in this way, what are the things that we're not quite comfortable with yet, and how do we unpack that to get that moving?
Yeah, it certainly requires a very genuine and earnest self-assessment around who we are now and where we want to be.
Yeah, knowing our story. Like, do we actually know what is actually what is happening? And infinite respect.
Infinite respect. Jo,
I think to develop that senior positions and things like that, it's you know, we are in there. There's a lot of our mob that do work, like we said, they don't want to identify, or they might not be in identified positions. It's not about creating identified positions, it's giving our mob a go, you know, like we do everyone sitting here on the panel has a degree of some sort. It's taking that chance and promoting us up, and, you know, and for me, the more in there, the better, because as you know, with that colonial load, that's the biggest burden, I think, being the only Aboriginal, you know, woman as the RAP manager at MARTA and in other services. When you're the only one working in there, you know, it's the extra work demands, it's the extra Aboriginal and Torres Strait Islander related work demands placed on us. whether it be things organising NAIDOC or, you know, different significant events or, you know, expectations of the educating others and, pardon me, and really taking that approach of, yes, I take it all on. I love my job. I have so much help at MARTA when it does come to organising events and different things like that. But the community engagement side of things, or even like I said, it's that colonial load that I carry every single day myself to make sure that, you know, I'm doing the best job that I can to empower my mob and have those things put in place. But over the years, like, I've worked so hard to climb the ladder where I watched other people pass by me. And I think that was something Darlene pointed out when we were having a conversation about, we don't brag about things. Like, I don't sort of I have a Bachelor of Social Work, I have, you know, a Justice of the Peace, I have this and that. Others do have that attached to their bios and things like that, which Darlene has now gave us the strength from this webinar to put that out there, show what skills we've got, you know, and build that. Like, if there's opportunities now that I see in MARTA to move up for professional development or any other skills that I can gain, you know, I'm going to get in there and give it a go. But I think it's encouraging our mob to apply for any of the positions. You don't have to be in an identified position. You know, we are adding to that. We encourage Aboriginal and Torres Strait Islander people to apply for those positions. So we'll be building our senior, you know, that workforce on that. But you know, other organisations have directors of Aboriginal and Torres Strait Islander and things like that in their organisations, which we all strive and we all jump at when those opportunities do come up to apply for. But like I said, I've landed in a really beautiful space with MARTA and within their reconciliation. In the last year and a half, I've seen a massive change at MARTA, and that's not on me. That's giving guidance and advice, but also leading the way for them to, you know, to build their workforce and to meet those actions and deliverables of our Innovate RAP.
Thanks for sharing that, Jo. I think I know how, you know, personal that is for you. And I, you know, for those listening, I only found out today, Jo shared with me all her qualifications, and, you know, I've had to sit with, you know, Jo's experience, wondering why someone wouldn't feel like they could publicly state or you know, feel publicly proud of all of their academic achievements. So I think that's a, you know, that's a really personal experience you've had, and I thank you for sharing that. Marika, the other two have spoken, Darlene and Jo have spoken about, you know, leadership, not just in designated roles, but across organisations. And that's obviously so important, isn't it? You know, you build something and people will come. They'll think if you know, if it's culturally safe for that person, maybe it's culturally safe for me. Maybe I can contribute my skill set. Has that leadership model been something you've seen work, Marika, in your experience?
Yes and no. I mean, going back just to Jo's point about colonial load, and we caught up earlier this morning to chat just before we were going to come into this, and I'd never actually heard anyone call it colonial load, because we've always called it cultural load. But I think that's just such a perfect way to describe what we experience every day in our jobs. I mean, who goes to their job every day and have to offer a piece of them that's so personal and so, you know, can be quite taxing and can be, you know, emotionally draining, which is what a lot of us often do in identified roles, that we, you know, constantly have to educate. We're asked questions that sometimes we don't want to answer, you know, talking about questions, that sometimes it's not the right day, or, you know, sometimes it's just a little more than you can bear, even. I don't think other people sort of understand that and understand what that's like. And as I've said, I've worked for Mercy for a really long time. Before that, I worked at the Women's. I've worked in tertiary health for ages, always worked in mainstream organisations, but in identified roles. And this has probably been my most senior role. And I get a little bit of what Joe and probably Darlene gets as well, which is, you become the go-to as well, for everything related to Aboriginal and Torres Strait Islander health. And I always say to people, I'm not an expert. I don't speak on behalf of my community. If you want to know what our community think, you have to ask them. I'm just the messenger. I'm here to advocate for my people. I'm here to lead a team of, amazing women that I lead across 2 hospitals to support and advocate for our people. But the gold standard would really be if we didn't have to have positions, we didn't have to have Aboriginal liaison officers, really. I mean, think about that for a minute. If that wasn't needed, that would be really the ultimate gold standard. And even people in my team even say, gosh, it'd be lovely to just be done out of a job. As much as our work is valued and needed and mob need us and love what we do, if we didn't have to be in the hospital, that would be amazing. And having the presence of more of our people in other roles. We want to see our mob, we want to see doctors and nurses and midwives and allied health professionals and all the rest of it, and in executive, on boards, and high up committees and all the rest of it. That's where we want to see our people. How do we do that? One of them is probably creating opportunities. It's so hard though. Like I don't have all the answers. We're just going into, I think, our 4th Aboriginal employment plan for Mercy, 3rd or 4th. And this time we did things a little differently. In that, we wanted to be a little more innovative this time and think about what's not worked and what could actually work in this space. I mean, admittedly, our Aboriginal and Torres Strait Islander employee numbers at Mercy are not great. They're not. And some would say, okay, well, maybe we're just not good at making it safe and available for our people to answer that question, tick that box when they're employed here. That's definitely probably part of it. But where to from here, I think we just need to keep working at it, obviously. But yeah, I'm hoping our next Aboriginal employment plan will really improve things.
Thank you for speaking so frankly about some of the challenges. And I, just speaking to a number of services across the Catholic health sector, I know how similar those stories can be around how hard it is. So many organisations we encourage Aboriginal and Torres Strait Islanders to apply for these positions, but, how do we kind of take it beyond that is a really important thought that we have to wrestle with. My next question's, in a bit of a different direction, and I might come to you, Darlene, on this one. It's on spiritual care. This is spiritual care and pastoral care is a very big thing for Catholic health and aged care facilities, and quite unique in kind of mission-based services, that offering. One of the questions we've had put to us is spiritual care a different thing for Aboriginal and Torres Strait Islander people? How is there something we have to be doing differently that recognises Aboriginal spirituality in how we deliver pastoral and spiritual care? I might come to you, Darlene.
Thank you. Just speaking on some experience, I'm thinking of a few episodes that have occurred in the past. I remember engaging with a member of the pastoral care team who had just been alerted that we had a Aboriginal woman admitted, and she rang me because she felt she wasn't allowed to speak to that person. It was very interesting. She was almost paralysed, but she knew that that was part of her role. And so I said to her, when we're talking about this spiritual care, it's a huge part of and a beautiful part of our tradition of care. Sometimes it can be as simple as walking into a room. Again, if you approach a person with respect, that's always, I think that's in the vibe. So it's a respectful interaction as you would with any other person in care. And offering the question, what do I need to know today to best care for you? What would you like to share with me that can, we can make things a little bit better while you're here with us, or that can improve, what you've been experiencing? What would you like to tell me? And I've come to that point because I know we've put a lot of time and effort and resources, and amazing work has come out of educational plans. But I've seen sometimes staff who will undertake education. They begin their truth-telling and truth-understanding journey. They come away with an understanding, a little bit of the understanding of the impact of stolen generations, and almost feel quite overwhelmed and feel that they need to bring that knowledge into that interaction with someone in care. So it's almost like coming in and saying, oh, do I talk to them about stolen generations? Do I ask about, do I do this, do that? Interactions can be fast, but they must always be respectful. And opening it up in that way is quite interesting. An elder in the bed or someone young in the bed, one of our younger, Aboriginal or Torres Strait Islander sports stars might say, oh, what's on my mind today is my spouse is at home and they've got to deal with the kids and all of the blah, blah, blah. So it's not actually about heritage as such. It's about humanity, and to work from there. Sometimes there will be we have had requests for traditional or cultural healing protocols to be followed, and that's respected and acknowledged as far as it can be, given all of the context. Sometimes just asking that question can be enough, and can be enough in a beautiful way. Not that it's a cop-out, but it actually gets to the heart and it starts that relationship.
Yeah, because at its heart, pastoral care and spiritual care is led by the individual.
That's right.
Yeah. And then we are called to respond to those needs.
Yes.
Jo, I know that Marta's doing things a little bit differently in the provision of pastoral and spiritual care, aren't they? Do you want to talk through how you've been working through that, providing appropriate pastoral and spiritual care to Aboriginal and Torres Strait Islanders?
Yeah, so our pastoral care team is amazing, and like Darlene said, it's up to the individual. So it's self-determination. It's our, I suppose we have our own ways of doing things with our connection to country and things like that. But I actually did a bit of work and with our Murray ministry, we've located only Alex Gator, a reverend. So our HLOs and other people on the floor actually know that if there is something that happens and our Aboriginal and Torres Strait Islander client or patient would love to speak to somebody culturally appropriate, they can then call the Murray Ministry and have somebody either come over or do it via the phone. Our pastoral care team is amazing, so I don't know, like that. There's no reason they wouldn't engage with them. Like Darlene said, it's an individual thing. It's that soft approach that they have that's just so, when you talk to our team, you can just feel that warmness and that calm, no matter who you are, when you talk to our pastoral care team, which is just awesome. But there is those options there, Marta, where we make sure that we've got those wraparound services, or we've got that relationships and stakeholders out in community that we can reach out to and really touch on that. But I think too, on that spiritual, like I said, it's empowering our Aboriginal and Torres Strait Islander peoples to make their own decisions, and cultural practices put in place at Marta where the spiritual care. So if we have a bub pass away or something happens, or an elder or something like that, we can actually do a smoking ceremony, or we can do our traditional practices to a certain point at Marta, which we've seen in the past couple of months, and it's been beautiful to watch.
Thanks, Jo. Marika, I wanted to, this final question I'm going to ask the panel, but we might start with you. We've, spoken really frankly here, with open hearts about some of the challenges that we're facing and some of the things we want to see change. What's something that you're hopeful can change, in the short to medium term that, maybe in your lifetime, what's something you think is something that we can really make progress on, whether that be in the health space or something more broadly, because we know that the health space has many connections across community. But what's something you think there's momentum on or we could find momentum on?
Probably just to have Aboriginal and Torres Strait Islander health is just a core part of what we do here. It's just core business. I mean, often, and this is not really a big criticism of sorts, but just often it's sort of I've seen here as a bit of extra work or a bit of add-on to someone's role, or, whether that's, carrying out actions from a plan or whatever it is. Sometimes I think it just seems to be an add-on, and sometimes we're even a bit of an afterthought in terms of, considering a diverse community, and that would include considering the needs of Aboriginal and Torres Strait Islander people. So ideally, I think, and also I talked about how if we just didn't need identified roles in these services, that would be fantastic. So just, having us as part of core business would be amazing. Just making us really visible as well and seen and heard would be amazing. I mean, I've got a team at Werribee Mercy that, work across a really busy and really acute ED service in, the Werribee Wyndham area here in Victoria. And they've just been making absolute amazing inroads with that service. And it's just been purely from just being present and just talking to people, just going up and saying hi to people and just introducing themselves and making themselves known to them. And something as simple as that has just, and again, it sounds really simple, but has just, I just had the director of the ED call me before and said, I just want to let you know that your team are doing amazing work down there. And I said, I know, it's not being unnoticed. We added a third member of the team just earlier this year because, I mean, the workload can be huge. But yeah, that's made a huge difference. The dynamic change between them, their presence in that service has been amazing. And they've just been making absolute leaps and bounds in that space. And it's such a challenging, difficult area. And we're getting good feedback from the community as well. I don't want to talk about the negative experiences of my people in the service all the time. I work for this service too. I want to hear good things. I want to hear about great relationships and amazing work and good experience and, somebody cared about me. Like that's what keeps us going. That's what we run off as well, is just hearing about really positive stuff.
Thank you, Marika. And it sounds like that Werribee team that you lead has such an impact in just their presence as a witness. And I think that momentum for integrated, those roles to be so integrated into hospitals and facilities and services is so important.
Yeah.
Darlene, I might come to you quickly, and then Jo, on something you're hopeful about changing in the short to medium term.
Thank you. For me, it would be monitoring and strengthening this movement into impactful allyship. I see this arising in many of our facilities. Staff who are not Aboriginal or Torres Strait Islander wanting to learn more, to do more. And I say impactful because there's power in that. There's power in that thinking and that solidarity. So we do great work. And I love that, Marika. We want to hear those good news stories that are real and a more appropriate reflection of what happens in for our people in our communities too. It's not always negative, and it's not always othering, but that impactful allyship. Actually, if our jobs were gone tomorrow or there were no more identified roles, the work of reconciliation, all of this good work should be continuing and embedded across. And I just always, in my head, I always play with this phrase of it's not about us and them. It's not about doing things differently with us necessarily, but learning from it. It's us and us as we move forward, stronger, rising together. So it's that, yeah, impactful allyship.
Impactful allyship. I love it. Jo, what are
Yeah,
you
so
hopeful for?
so for me, I think it's that equal opportunity and health and well-being of, you know, like we all understand that we're 2 to 3 times more likely to have chronic diseases, and, you know, the outcomes of our health is, you know, things like that, but also our life expectancy. So, you know, as I've mentioned before, like my grandparents and parents and things like have passed away prior to being 50. And I would love to see, you know, reconciliation be done at its best, closing the gap done at its best, but also recognising our short life expectancy, that and to have a look at like accessing our super earlier and our retirement funds. And, you know, we go into aged care facilities, you know, like it's just, we're going to be using that funds for those things, but, you know, and our retirement age is 67 and things like that. But a lot of our mob know that we're not going to be here at 67. So that's something that I have a passion about seeing changed in the future is, yes, we're working on that life, that, you know, the healthcare of our mob and things like that, but in our DNA, it's already there. You know, it's written on the wall, like, just to be able to retire earlier or accept, you know, access certain things would be amazing. But I think, yeah, that bringing that closing the gap and reconciliation to the forefront is business as usual, and really making that health equity count is what I'm passionate about.
Thanks so much, Jo. So we've approached the end of this webinar, so I want to take some time to encourage all those who listened or will listen later online to reflect on some of the things we've heard today. I know, you know, at CHA, we're in the process of finalising our first reconciliation action plan with the help of these 3 panelists as well. And it reminds me of how there's just so much more work to do, and we're always called to seek out those needs in Catholic health and aged care and focus our energy there. And I can only assume that if our founders were around today, they would see some of the things we've spoken about today, you know, the disparities and the matters of injustice that have permeated, and engage with an utmost focus here. So where does that leave us? I think that requires us all to think really seriously on that. We'll be doing more of this in this space at CHA under the guidance of those like our wonderful panel who have shared their thoughts so respectfully with us today. Can I thank Jo, Darlene, Marika for their insights, their expertise, and their sharing of their hearts during this webinar. It isn't always easy to share the things that are so close to us and deeply personal, and myself and the other listeners are the beneficiaries of that. So thank you. And thank you to everyone who tuned in to listen and to learn today. I hope you've learned something new, or this has given you further food for thought in your own lives and your communities and your workplaces. So until next time.
Thank you.
Thank you.